Welcome back to Great Day Medical Monday. There are all kinds of medicines out there to address fatigue, hair loss, depression, weight gain, and fertility issues. But before you start downing pills and potions, consider listening to what your body is trying to tell you. All those symptoms could be related to some common problems that are easily treated. Welcome back, Dr. Drshelenalaljiesthetics, the founder and director of Dr. Shel Wellness and Medical Spa. Kind of dovetailing on what we were talking about earlier is that oftentimes we try to address all the symptoms, but we forget about just getting rid of the underlying cause. I am asked so much about, in particular, hormones and things like that. And so we have some viewer questions here. We have Catherine. The first question: I'm 39 years old and have very low energy, depression, low sex drive, and cannot sleep. I feel like I'm too young for this. I have a busy life, lots of stress, and feel like I'm falling apart. What can I do? Now, oftentimes what happens is, oh, you're depressed, let's give you an antidepressant.
Let's give you an antidepressant.
You don't have any energy, have some more coffee.
There you go. There you go. Well, it's just like we discussed, and I think it's really important, especially for women in their mid to late 30s into their 40s, to realize that there are some serious hormonal things going on in their body. One such hormonal fluctuation is called estrogen dominance. What's happening with that, Deborah, is the progesterone level is declining rapidly.
It's kind of the feel-good hormone,
Exactly. That's your, antidepressant hormone. That's your natural sleep hormone. That's like lift-me-up hormone. So a lot of these women are going through estrogen dominance and then dealing with depression, high stress, anxiety, going into what we call adrenal fatigue and adrenal exhaustion, because we're trying to do way too much and not giving enough to our bodies. So then they can't sleep, they are depressed, and once we start balancing their hormones, we could do an easy saliva test, do a nutritional test, balance their hormones, and get some natural progesterone in them, and really manage that stress as well and deal with the adrenal glands.
But this speaks to the importance of going to a doctor who specializes in this, because, again, a lot of times what a doctor might do is medicate those symptoms. What you're doing as a specialist is listening to the symptoms, going, that points to...
Correct. To really going to the bottom of the issue and the core of the problem, rather than taking one symptom and putting one medication on there. So you really want to look at the entire person, which is why we spend 45 minutes to an hour with each patient to really understand them.
All right. Julie says, I'm 42 years old and have gained 37 pounds in the last year. Plus, I am losing hair, have dry skin, and constipation. I think it might be my thyroid, but my doctor says that is normal. We oftentimes hear you're within the range.
Exactly.
Whose range are we comparing you to?
And so I think we all know that the range for thyroid testing is incredibly wide. So if you think about your range being this wide, being the normal range, really the optimal range is about this wide. And so you want to make sure that you address this with your practitioner and get a complete detailed analysis of your thyroid, including free T3, free T4, reverse T3. But really, the thyroid hormone is sort of at the center of everything that's going on. So if you're losing hair, don't feel like you're alone. You really need to focus on how to get your hair back, how to get your weight off, and you might be exercising.
The thyroid also impacts your metabolism.
Exactly, because it really impacts your metabolism, and if you don't have the correct thyroid balance, your weight is not going to come off regardless of how much you exercise or lose weight.
And then of course digestion problems a whole bit, so get the probiotics in there.
Exactly, very important to do all of those things.
Okay. Question 3 comes from Sherry. I'm 48 years old and feel like my skin is sagging. I have large pores and wrinkles that just popped up. I need a lift but don't want surgery or downtime. And that's one of the things that we put off getting things done because sometimes we don't want to do the full meal deal.
No,
we don't necessarily have to anymore. Technology.
We're very lucky because we have a lot of advances in technology where we can actually have an FDA-approved procedure called Ultherapy done, where it can lift and tighten the skin without any surgery, no downtime. Again, it's called Ultherapy, and it's very safe, very effective, and no downtime.
Yeah. So what? So it's like a laser or
ultrasound therapy.
Okay.
Ultrasound, tried and true. For decades, it's been around, and it's going to the same layer that the cosmetic surgeons are going to, about 4.5 millimeters deep, and really lifting everything up without any downtime. So it's fantastic.
There's no cutting. There's
no cutting, and then you can then work on your pores and your fine lines and wrinkles with things like Botox. We use fillers, all kinds of fillers, and then also microneedling and platelet-rich plasma. It is the best thing out there right now.
And balancing hormones, because thyroid also impacts your skin, right?
It impacts your skin. You don't want dry skin because dry skin skin leads to early wrinkles and premature aging.
Okay,
so, yes.
And how often would you have that ultherapy done?
So you have it done only one time, and then you might need a maintenance treatment after that. But one time, and that's all you need. And within 3 to 6 months, you have this slow progression of tighter skin.
Yeah.
So if you're in the mirror going like this every day, this is it.
All right, let's wrap up with Karen says, I'm 53 years old and have hot flashes, night sweats, and no sex drive. My doctor is giving me synthetic hormones, but I still don't feel good. My husband says he wants his wife back. Please help.
Yes,
all right,
that's
synthetic
true.
Hormones may be an issue.
That is an issue because we know from 2002, WHO did their study where we found that synthetic hormones were leading to Prempro and things like that, leading to heart disease, cancer. But if you look at bioidentical hormones, these are hormones that are biologically identical to what our bodies produce. So we can then get on natural biased progesterone, testosterone, DHEA to really get our vitality, our energy, get our
Your body doesn't know
back.
it's not producing it
Our
by
body
itself.
doesn't know because it recognizes the exact hormones in our bodies.
All right. We know there's a lot of information here, but Dr. Shel is hosting an open house on Wednesday from 9 a.m. to 5 p.m. where you can find out more on all the services she offers. There's more than just this. Dr. Shel's Wellness and Medical Spa is in Sugar Land at 1437 Highway 6, Suite 100. Plus, Dr. Shel has a special offer. If you call today, get up to 20% off hormone, nutrition, allergy, and food sensitivity testing. Basically, if you're not feeling good, they can probably pinpoint why. But you must mention Great Day Houston. The phone number is 281-313-7435, 281-313-7435. Mention Great Day. And you can get a free copy of her ebook on her website, drshel.com, which addresses a lot of these issues. Thank you.
You're welcome.
Well, beating the buzzer with